Welcome to week 3. In this week, I'm going to talk about 2 PowerPoints in preparation for next week's class, and I'll go over the quiz contents first. You will also have 2 ED puzzle videos to complete, the X-ray tube and X-ray production. I suggest you watch them in this order, X-ray tube first and X-ray production. All right, so let's go over the quiz really quickly. It might take about, hopefully not too long. We'll go through the questions and answers one by one, and I'll provide expanded explanations as necessary. Question 1. Examples of medical imaging modalities are, obvious answer will be ultrasound, MRI, DEXA for bone density, and X-ray. Number 2. MRI uses sound waves to create images of the body. That'll be false. Ultrasound uses sound waves. MRI, magnetic resonance imaging, well, it's in the name. MRI uses a magnet. Number 3, when an atom loses or gains electrons, what do we call that? Ionization. Number 4, what subatomic structure does the plus sign represent? That'd be protons. That's in the nucleus. In the nucleus of the atom, we have protons and neutrons. Protons are positively charged, neutrons have no charge, and the electrons orbit the nucleus. Imaging modalities do not utilize X-ray tubes are, that'll be MRI and ultrasound. Hopefully you selected at least 2 options. MRI and ultrasound do not have X-ray tubes. Fluoroscopy and CT scanners do. Nuclear medicine images create images with the use of radioactive materials, not X-ray energy, not sound waves, not an electron beam. Number 7, match these terms. Protons are, well, I said it earlier, positively charged subatomic particles. Electrons are negatively charged. Atomic number is the total number of protons. Remember that atomic mass is the number of protons and neutrons. Neutron is a subatomic particle that has no charge. And there's a percentage breakdown for the correct answer of each of these. Number 8, the HIPAA law was created in response to increased use of electronic health records. That'll be false. That'll be the high-tech law. HIPAA is just generalized protection of patient information. The high-tech law came after that. Some CT scanner components are, let's go through them one by one. Display recorders? No. Let's go to the third option. Camera flat panel detector. That would be in fluoroscopy, not a flat panel detector. And not an image intensifier. DEXA tube? No. So the only correct answer here will be option B, as shown here. Gantry, the display monitors, the table, and the CPU, central processing unit. It is appropriate to text recognizable patient information only if the ordering physician requests it via email. False. There are authorized texting applications depending on where you work, where you can take a picture of patient records, send patient information, and so on and so forth. The place where I work right now is they use one called Tiger Text, and they are a variety of these texting applications. You can also use email, but it has to be encrypted. It has to be approved email, meaning not through Gmail or your Outlook or your Yahoo and so on and so forth. And it has to be on a need-to-know basis. Is this information relevant to complete the recipient's job? That kind of thing. Your health records password should not be shared with any individual. That'll be true. Number 12, select the most appropriate statement regarding the CT technologist's role. One second, let me just correct this. CT technologist's role. The CT technologists are required to interpret examinations to provide a verbal report to the patients in emergency situations. No. CT technologists are required to have a good understanding of the anatomy, physiology, and pathology in order to perform high quality imaging with high diagnostic information. That will be the most accurate one. You do not need to know about pathology. Of course you need to know about pathology. The radiologist relies on the CT tech to provide a second opinion on patients' diagnoses. Now, number 13, when is it appropriate to reveal a patient's diagnosis to their family members? Never. None of these are correct. Number 14. A local research firm asks the supervisor for patient records to help with a lung cancer study. Your best course of action is do not send the patient information. Report the incident to your department head. You can't provide information. Don't send it after you have clarified the study is legitimate. That doesn't matter. Send your personal records. Send your personal records. This is me in the future, so by the time you've done this quiz, it will say your and not you. Send your personal records in order to protect patient privacy. Select the option which demonstrates respect for an elderly patient's autonomy. The patient is lucid and refuses the CT scan. Best option, I understand that you're refusing the CT scan. What concerns do you have about the study, right? Important thing, the patient is lucid. They have all their faculties, right? They can reason, they can ask questions, they understand what's happening. Because they're elderly doesn't mean we should ignore their requests or their preference to refuse the study. This is not something that's appropriate. Sir, X says you should have this study, so you must do it. You must go on the table. That doesn't happen. That's not something that we should ever do. At your age, obviously you're gonna get yourself in trouble here. You are probably just confused. Even if the patient is confused, that's not a thing that we should say. Match these terms with their definitions. Radiolucent, a material that easily allows the passage of X-rays. Radiopaque, the opposite. Software, a set of computer programs. Hardware, the physical parts of the computer. So for example, your keyboard, your mouse would be the hardware parts of the CT scanner. The software will be the programs that you see running in the background, sometimes on startup or shutdown of the computer. But the radiopaque things that you should be concerned about for CT would be the contrast that we inject or the patient drinks or we insert into the patient's orifices. Radiolucent parts of it would be things like the table, the straps, and so on and so forth. There are some materials that traditionally were radiopaque, meaning they would show up as metallic objects, such as some braces for the joints and so on. Fortunately, now they've made them, a lot of these, routinely out of radiolucent material, and also non-metallic or non-ferromagnetic, meaning they can go in CT and MRI. An elderly patient arrives for a CT scan, and you are unsure if the client understands the instructions. Your best course of action is ask the client open-ended questions to solicit clear responses. As a refresher, open-ended questions is one that you can't just say yes or no to. So you can say, closed-ended would be, do you understand? Yes. You can say, okay, why are you here? That's an open-ended question. So now they have to explain, right? And this will prove that the patient understands what's about to be done. There are a lot of patients, and this has happened a lot of times, patients will come in and English is their second language, and they just want to get it done, and they don't understand the implications of having the wrong study or even imaging the wrong person or doing something that's contraindicated, or the dangers of having a CT scan if it's not necessary, right? So they will yes you to death. So sometimes I throw in a question that they have to answer open-endedly. So I would say, for example, some of the routine questions I would ask is, do you have any allergies? They would say no. Have you had a CAT scan before? They would say no. These sound appropriate, right? And then I would say, do you understand why you're here? And this is where they get tripped up. And then you find out that they actually don't understand English. Sometimes it's not put on their records that English is their second language. But then there are subtle ways you can ask it without assuming because someone has an accent or they have a foreign sounding name that they do not speak English, because that's also unacceptable. So first you sound it out, give them a chance to respond, and you ask key questions that require them to express understanding of what's about to happen. After that, then you can ask, do you understand what I'm saying? And you slide into, okay, do you understand, what's your preferred language? Questions like that. The X-ray tube is housed in this section of the CT scanner. The analog to digital converter, or the digital to analog converter, that's the ADC or DAC, no. The CPU, no. The table or the couch, no. The gantry, it's in the gantry. So CT gantry. As a reminder, this is the gantry right here. This is where the CT tube is. You can see it here in this image. That's the X-ray tube. Those are the detectors. All right, so the X-ray tube is housed in the gantry. On this image, you can see it here. So these are the detectors under here. Number 19. You are with the medical team during a special CT procedure, such as a biopsy or drainage or something. The radiologist gives you instructions for medication, including the dose and name of the medication. Which of these is considered closed loop communication? All right. The best option here is repeat the instruction aloud verbatim. This is a good way to confirm that the correct instructions were given and received. And this is very, very important. Very, very important, because that's how the doctor will know that you understand what's being said and what is required of you, right? Sometimes people just assume that you're doing the right thing. But if you repeat the instructions aloud, it seems a little elementary, right? Something that almost like too basic. But this is a very important step. Get a notepad to document the instructions. You could do that, and fill these with the patient chart. Yes, but at the moment you're being asked to complete a task. This is what you need to do. Repeat the instructions aloud. So the doctor will, he or she will say to you, 5 milligrams of lidocaine. Did you say 5 milligrams of lidocaine? Put it up, hand it to the doctor. Ask the radiologist to repeat the instructions prior to completing the task. You can, if it's not clear, right before completing the task. This is your step. Ask your coworker to confirm what the radiologist said. That is the least responsible thing to do. Number 20. The main difference between a sign and a symptom. Signs are objective, meaning no matter who looks at it, who evaluates it, who measures it, they're going to see the same outcome. Is it broken? Can be seen by everybody who observes it, right? Patient has a fever. We can easily find this out by measuring the patient's body temperature. Symptoms, on the other hand, are subjective, meaning depending on who's experiencing it, you might get a different description of what's going on. I'm having pain. How much pain? It just depends on who's experiencing this. I feel a little dizzy. How are you going to measure this really? Someone has explained this to you. The room feels like it's spinning. These are all sensations. So basically, if it feels like, it's going to be a symptom, generally speaking. If it is something, as in unquestionably it is something, it's a sign, meaning you can measure it, you can see it, you can observe it. Everybody can see this is what it is. Number 21, parts of a CT scanner system, such as the keyboard and mouse, we just talked about this, are software. No, that'll be false. That's hardware. The computer programs or algorithms that provide operating instructions for the CT scanner are referred to as hardware. That's also false. That's the opposite. So both of these are switched around. Number 23, objects that are dense have high atomic numbers than less dense objects. That would be accurate, right? A CT scan table is radiolucent to block the passage of X-rays, thereby protecting the patient. That'll be false. CT scanner table is radiolucent because the X-ray is passing through the table and the patient to create the image. This is the table here, The X-rays are passing through both of them, the patient and the table, to get to the detectors to give you the image. And that's the last one. Pretty straightforward, I think. Pretty straightforward. All right, so now let's get into the PowerPoints, which are for next week class, but it makes sense that we talk about them now. I wanted you guys to understand it's not just to look at cross-sectional images right away, but you should have a basic understanding about the X-ray tube and the CT scanner itself and the role of the technologist. But so a part of this involves, an essential part of this is understanding what's going on inside the gantry, right? And so just now we did on the test that a CT scanner has an X-ray tube in it. And from your classes so far, you've already learned basically what an X-ray tube does and what's going on inside. So we're going to do a quick review of that, and I'll talk about the difference between the X-ray machines and the CT scanner. So we'll start with slide 1. The same principles apply. The conditions for X-ray production would be a source of free electrons and the means of accelerating the electrons and the means of decelerating the electrons. So the source of free electrons would be the cathode. And that's where the filament gets hot and electrons are released by thermionic emission. Actually, I'm not going to repeat this because that's in your PowerPoint, also an Edpuzzle. And then the electrons are accelerated towards the anode, right? And that's accelerated by means of a kVp, the voltage that's applied. Remember that voltage, let's see if I can type here, voltage is a couple names, electrical potential difference, also has another name, electromotive force. They don't care about that word, it looks like electromotive force. That just means a difference in electrical potential between 2 points. That's what's happening. All right, that's what voltage means in a bunch of different ways, right? Let me see if I can make this larger. Nope, I can make this. Okay, you can see it. So voltage just means electrical potential difference or electromotive force, and that's responsible for accelerating the electrons from the cathode to the anode. And the means of decelerating the electrons, well, that will be the anode. So when the electrons strike the anode, we get X-rays. X-rays are created at the anode, electrons are released from the cathode. So when we look at the CT gantry, the X-rays are created in the X-ray tube, and as it spins around the patient, we are constantly releasing X-rays as it spins around the patient. All right, so whereas with X-ray, we have a stationary tube and we have a stationary tube and a stationary table. It's an old machine. Stationary tube and a stationary table. With CT, we have a rotating tube and a table that's moving. So almost everything is in motion here. All right, so the X-rays are produced in the X-ray tube, but then we're continually releasing X-rays over the length of the body part we're imaging, right? Okay. Let me bring up the other one first. So we need the same three conditions for X-ray production. Difference is the X-ray tube is now spinning. So electrons are released from the cathode. They hit the anode, we get the X-ray beam, but now the tube is spinning. Remember that the cathode is negatively charged. The anode is positively charged. Same thing applies. So whereas with X-rays, remember that most of the energy conversion that happens in the X-ray tube is heat. Only about 1% is turned to X-rays. Most of it is heat. So if you turn off the AC, in the CT scanner room is going to get considerably hot. And in X-ray, it will get hot for sure, but not as much because we don't use as much X-rays as we do in CT. So we need a cold room. So patients are always going to get cold in the CT scanner room and the X-ray room. But the good thing is in X-ray, they're not there that long. But in CT, they're there for a long time. Sometimes 10 minutes, maybe 15 minutes. So, and the difference with the temperature difference is significant inside the CT scanner room. So they're going to be cold. So once they get in here, we often give them a warm blanket, right? Because we need to cool the machine, because most of the energy conversion is heat. About 99% of this is heat. All right. This part you should know, but I'll go through it briefly. The cathode consists of focusing cup and filament. And with the CT scanner, in some machines you can change the filament size. That will, depending on what body part you're imaging. So you use the smaller filament for small body parts when you want high detail, and the larger filament for larger body parts like the abdomen, but you don't need as much detail. You're not looking for small fractures kind of thing, right? With CT, it's not that big a deal to do that because there's so much resolution, because we're getting different imaging planes. Whereas with X-ray, resolution is paramount in two-dimensional imaging because everything is overlapping. So you need as much detail as possible when you're looking for small fractures, right? So if you're looking at an X-ray image, let's say X-ray forearm fracture. You can see you know what would be good? Let's look at tibial plateau. Let's not do the surgery. This happens relatively frequently. Sometimes there's a suspected tibial plateau fracture that we're not sure. So something like this you would see on X-ray, and they want to classify this to see how they're going to approach this with surgery. They would go on to do CT. But you would have the machine will probably select a small focal spot size to get as much detail as possible to visualize this fracture. And on CT, we can see it relatively easy. Let me find some images here for us to look at. Let's look at the axial images. And let me make this larger. There you go. Let's make this larger so we can see not the same patient regardless, but let's just look at it regardless. We're coming up here and we can see now the tibia and the fibula. We can see that fracture right across here. And this is the advantage of CT. Whereas you can see that something's wrong on the X-ray, on CT it will tell you exactly the extent of this fracture. This will be very important. They don't have to wait on surgical intervention to find out how bad the fracture is. CT will give a lot of information. Let's look at a different plane. We're looking at the coronal plane here. Remember, coronal plane separates the body into anterior and posterior sections. We can see all that. It's not a very good coronal image because it's still kind of blurry. So maybe this stack wasn't done with thin images. Don't worry about that right now. And then let's see if we can find, I bet you this one's better. That's more like it. All right, so not the same patient. It doesn't look like it. But this is a very detailed image. Maybe it's not. Is it the same patient? I don't know if it's the same patient, but this one has a cast and much better imaging. Let's look at the sagittal. And remember, sagittal goes from left to right or right to left, separating the body into sections of left and right. All right, and that's the beauty of seeing CT imaging. All right. Right, so depending on the machine, in X-ray you can select a different focal spot to see fractures. In CT, it's not so important. You don't even have to make that change at all. So once we have, well, you should know this already, but I'll explain once more. It's the same process happening in CT. We have a space charge. This means there's a cloud of electrons that are released when the filament gets hot, when you apply the MA to the filament. And that gives you the thermionic emission that's now released towards the anode. Same kind of thing. And the focusing cup that's negatively charged is so done because it's necessary because it helps to focus the electrons in a steady stream towards the anode, so we can hit the actual focus spot on the anode. Same kind of thing is happening in CT. All right. And we talk a little bit more about the major parts, or the most important parts of the X-ray tube. The focus spot, the anode, the rotating bits. Okay, the other bit that's important, and it's common with CT and X-ray, is that it still has an induction motor. The how we can expand on that for CT is that, if you recall, I played a video in last week's YouTube video, CT gantry spinning. And you have to imagine, see if I can, let me see if I can, okay. 1 second, let's wait for this ad to come off. Here we go. So you have to imagine, how is this spinning? Think about this. How is this spinning and getting power? How is this getting power to spin? Because if you have something that's getting energy, how is it spinning? Well, in a similar way that the induction motor moves, in a simple, 1 second, I'm gonna turn off this AC because it's making a lot of noise here. Maybe you can't hear it, but I can. Off, okay. In a similar way where the induction motor moves, with we have to make sure the glass envelope is not compromised, because energy is transferred from the stator to the rotor, and that spins the anode for the X-ray tube. Well, the CT scanner has what's called slip rings. And are some versions of this. And what that does is transfer the energy from the power supply to the gantry. So everything is powered that way. There's no continuous wire, because if you think about it, if there was a wire that was connected from the power supply to the X-ray tube, as is the case with an X-ray machine, it wouldn't be able to spin so fast continuously. Machines of old would spin in one direction, then stop and rotate to unwind and rotate the other direction, that kind of stuff. But slip ring technology allows us to have continuous power, and so the gantry can spin in one direction indefinitely, right? Without worrying about winding up the power cord. So slip ring technology functions in a similar way to the induction motor of the X-ray tube, where we don't want to compromise this glass envelope, but power is transferred from outside the envelope to the rotor. And slip ring technology, just to make sure I'm saying, you can understand what I'm saying. Slip ring technology is what allows that to happen. All right, so this is just a further explanation of what's happening here, where the power is transferred via the induction motor. And so the second PowerPoint goes on to what's happening now at the anode, an X-ray production. So in X-ray class, you'd have learned about the different types of X-rays that are produced, and we're going to talk about a little bit of that. But just know it's a similar thing that happens in a CT scanner. And so the basics of this would be mass, velocity, kinetic energy. Where things moving faster, things have a higher velocity, well, they have a higher kinetic energy. Remember that kinetic energy is energy in motion, right? Kinetic energy is energy in motion. Right? So if something's moving, it has kinetic energy. So electrons are moving from the cathode to the anode. They have kinetic energy, right? So higher velocity, and what gives it velocity? That condition for X-ray production, the kVp. Higher kVp means it has higher velocity and higher energy, can penetrate more. So it stands to reason that objects that have lower energy, or lower kVp in this case, they would have lower kinetic energy. Right? Now electrons don't have any mass, so we don't really change that, but we can impact the energy of the beam by changing the kVp. Right? With CT, we don't make that change. We can, but we don't have to. The machine does that for you. Now it's still necessary to know this, because there are times when you might have to make some of these changes. What are these conditions? Well, the first one is not all machines have set or programmed pediatric protocols. So be careful. It might still happen. It's supposed to have it. I think by certain standards, the JCERT standards, you should have it. But you should know, and I also talked about this in one of these videos, that kVp impacts the dose and how much MAS is produced, right? So for kids, their body parts are smaller, so you would need lower kVp. And there are some machines that adjust the kVp, depending on the thickness of the body part. And some machines also adjust the MAS, which is fantastic. Because if you imagine that you're scanning somebody's abdomen, right? If you're scanning somebody's abdomen, CT, let's do CT abdomen. If you're scanning somebody's abdomen, some parts of the patient's body would be less dense than others. So imagine if you're going through the upper part of the abdomen, where you have partly diaphragm and liver and so on. The machine would make accommodations for that. We call it variable MAS. They would change that. So we'd have a lower MAS, probably lower kVp, depending on how modern the machine is. And that will just adjust along the length of the patient, the Z-axis, we call it, right? The Z-axis. Z-axis. So we have X, Y, and Z. So X, Y, and the Z-axis is now along the length of the patient. So along the length of the patient, the Z-axis, it would just adjust. So depending on the thickness of the body part, the machine would make adjustments. Now, how would it do that? When you take your scout images, the CT scouts, which is akin to your X-rays of the body, you take the scout images. The machine uses that to calibrate or to prepare for what amount of exposure is necessary to image the body with the lowest dose possible. And in some machines, they have what's called DLIR, dose limiting iterative reconstruction. I can't spell it, looks like. And so they would use that kind of stuff to lower the MAS, lower the kVp, and still get diagnostic images along the Z-axis of the patient, right? So that's basically what's happening. In any case, what you should know is that the KeV, or the energy of the beam, is impacted by the kVp. And depending on the body part, we use a lower or higher kVp. And modern CT scan machines make that adjustment for you. However, you should be aware of this, because one case that I mentioned earlier, you might make changes, would be for pediatric patients and also smaller patients. You might need to know how to make that change on the scanner, right? The other time that you might need to do this is you might go to a department where the manufacturer default protocol would require too high of a kVp. So for example, for an abdomen, we can use maybe 140 kVp or 120 kVp. For a HCT, we don't need that, but it might still say 140. And that would give you a significantly higher dose than a lower kbp setting. So you got to know at least how to make these changes, just like you do in X-ray. Right? Okay, the two types of X-ray production will be the same, Bremsstrahlung and characteristic. I'm not going to go through all of this except to say that Brem is just slowing down, as in the incoming electron now approaches the nucleus and is slowed down because of the attraction between the nucleus, which is positively charged, and the electron, which is negatively charged, opposites attract. And the difference, the loss of energy is given off as X-rays. And most of the X-rays produced at the anode is Bremsstrahlung. I think it's about 85%. About 15% is characteristic. That's where electrons are ejected by the incoming electron, and then other electrons fill that vacancy, and the difference between the energy shells is given off as characteristic X-rays. About 15% of the X-ray production is characteristic. Right. All right, so just as a reminder, for thicker body parts, you're gonna need higher kVp, and vice versa. So you should at least know how to make those changes as a CT technologist. MAS, you got to know how to change that too. However, here's the difference. You change it, whereas in X-ray you make MAS selections, as in how much current and for how long. In CT, you change MA, because how long depends on the pitch, or how fast the table is moving, right? How long you're exposing the patient for. So you don't use MAS, so to speak. You select MA, and then the dose is calculated by DLP, as I would call it, DLP, or dose length product. This means how much dose is given over the length of the body that we're irradiating, the body part that we're irradiating. All right, so just to cover that whole thing again, MAS is not used the same way in CT as it's used in X-ray. So in X-ray, you select the MA and the time, as in say 400 MA at 0.05 seconds, and you don't select time as much in CT. What you can do is speed up how fast the gantry is spinning. And that does decrease the exposure, right? Because if you think about it, if we're spinning the gantry fast, that means the table can move faster, which means you're covering more body part per centimeter. And then you can get a lower MAS. There are times when you will speed the gantry up, and that's speeding the gantry up is akin to using a shorter time, a shorter exposure time. And so it stands to reason if for X-rays you use a short exposure time to limit the impact of motion artifact. It's the same thing for CT. So you have a patient who is restless, or they have trouble remaining still, you might want to speed the gantry up. And that's similar to what we do, or the reasons why we use a shorter time in X-ray. So you just speed the gantry up in CT to get a shorter examination time. What would that do? That would make the table move faster. That would make the table move faster in and out of the gantry. We get a quicker examination, and it lowers the impact of motion artifact. All right, so we've covered both PowerPoints. I'll try to put timestamps in here for which PowerPoint I go through, and so on and so forth. And let me just use the rest of this time to go through what you should expect for the upcoming week. There'll be a class PowerPoint. There'll be these two PowerPoints that are on Edpuzzle. They have their own text that you should follow, and Edpuzzle will have the different questions that you should try to answer. And there'll be a group work which we'll talk about, and discussion entry 2. Remember, these have their own due dates and they're all graded. All right, take it easy.